So happiness. Flip the script. Nocebo and placebo. Part 1. If the brain expects that a treatment will work, it sends healing chemicals into the bloodstream, which facilitates that. That's why the placebo effect is so powerful for every type of healing. And the opposite is equally true and equally powerful. When the brain expects that a therapy will not work, it doesn't. It is called the nocebo effect. Bruce Lipton. I shall cause harm versus I shall please. My nocebo. The surgeon came in, briefly looked over my chart, took hold of my hand and said these words that would haunt me. I am sorry, but we are only going to be doing palliative care. In that moment, and in that time, the world stopped. Everything started going in slow motion. Her hand in my hand felt like a branding. Those words would be seared in my mind. I sat there in total shock and disbelief, trying to wrap my head around what she had said. All I could think of was that, I am going to die. I knew more than most, as a hospice counselor, what palliative care meant. In the medical world, the main goal of palliative care is to keep the patient comfortable, not about finding a cure. The surgeon was the authority or influential figure in our relationship. There was clearly high emotion involved when discussing cancer treatment options. The guard or critical faculty was down. When the guard is down, seeds are planted. The seed that she planted in my subconscious was fear. I thought I was going to die. There was a tiger, metaphorical, coming for me, and I needed to figure out how I was going to fight it. I knew on a conscious level what she said was not factual and that she did not have all the information regarding my case. However, I took her words as truth on the subconscious level. The damage was done. I would struggle for months with insomnia and thoughts of death haunted me. These fear-based thoughts permeated all aspects of my life, even after surgery, chemotherapy, and subsequent negative lab results and scans. I was obsessed with my health and became the consummate hypochondriac. I was convinced that every little bump, weird body sensation, or pain, was the cancer coming back to kill me. I was living my life in total survival, in the sympathetic nervous system fight, flight or freeze mode. I was living as if there was a tiger coming at me, but the reality was that there were no tigers, only little pussycats. The cancer was gone. The surgeon, with her searing words and lack of due diligence, could have ultimately done irreparable harm had I not found hypnosis and other tools for my emotional and physical well-being. What happened with the surgeon is called a nocebo. Nocebo is a Latin word meaning I shall cause harm. Please note that this was not intentional on the part of the surgeon. A nocebo is just the opposite of a placebo. A nocebo is a detrimental effect on health produced by psychological or psychosomatic factors, such as negative expectations of treatment or prognosis. A nocebo effect is when a patient has a negative expectation regarding treatment that causes the treatment to have even more negative side effects than are typically experienced. My role as a hospice counselor was to help the patient and family get their affairs in order and to help them prepare for death, noting to the patient, in so many words, that the qualifications for being in hospice include that they may have 6 months or less to live. The most intriguing or haunting part is that most patients would die within that 6-month period. I often wonder if the outcome would statistically be different if hospice, and other medical providers, communicated with more optimistic and hopeful language. After the initial shock of that nocebo conversation, I chose to flip the script. I had a bilateral mastectomy, chemotherapy, and took other agents to block the hormones that were feeding the cancer. I made the choice to heal. Note, I did not say my cancer. I do not want to imprint or own cancer in my psyche. The oncologist dutifully informed me about all the side effects of the drugs that I was taking. I would inevitably experience many of the stated reactions like nausea, hair loss, fatigue, and poor appetite. I wonder, knowing what I know now, if I would have had all the side effects had I not been informed of them by an influencer. Maybe, or maybe not. There are many well-documented incidents which include people who had overdosed, taking sugar pills. The patients had all the symptoms and side effects of the real drug, including a measurable drop in blood pressure. This shows how powerful beliefs can be. Medical professionals need to walk a tightrope when discussing patient diseases, disorders, diagnoses, and especially their prognoses. My heart sinks when a doctor tells their patients that they will have to battle diseases like substance abuse, anorexia, mental illness, or other disorders for the rest of their lives. This is like sentencing them to life in prison. These medical professionals may be unwittingly taking away any self-empowerment and hope from the patient. Whenever physicians are discussing a prognosis with their patients, they need to be acutely aware of the language they use. Note: I cringe when Alcoholics Anonymous meetings reinforce the sentiment that they will be alcoholics for the rest of their lives. This type of sentiment is what may be programming them to be alcoholics for life, as they are much more than likely to buy into the self-fulfilling prophecy. An example would be saying, "You're a bad girl," instead of saying, "You are a good girl who did a bad thing." It can damage her self-esteem and reduce the likelihood of her making better choices. What you say after "I am" will become your life script. Continue on to part 2.